Mrs. Valerie Allen, Chairman of the Southwest Regional Health Authority, Dr. Brian Amor, Chief Executive Officer of the Southwest Regional Health Authority, members of management team of the Southwest Regional Health Authority, members of the media, good morning. Happy New Year and welcome to the San Fernando General Hospital. I know that you were waiting. Just thank you very much for your presence this morning. Without further ado, please help me welcome the Chairman, the CEO, of the Southwest Regional Health Authority, Dr. Brian Amor, who will provide a brief overview and welcome to you this morning. Dr. Amor.
One and all, Happy New Year. Minister of Health, Honorable Terrance, Deyalsingh, Mrs. Valerie Allen, Chairman, Board of Directors, all other protocols observed. Welcome once again in 2021 to San Fernando General Hospital and by extension the Southwest Regional Health Authority. We are very pleased with your presence today and very pleased to be, again, great like the presence of the Honorable Minister, who would have shown appreciation to staff recently and is also here today to bring year's greetings and also to engage yourselves at the media for today. So without further ado, I'd like to invite the Minister of Honorable Terrance Deyalsingh to the podium.
Brian, Chief Executive Officer of the Southwest Regional Health Authority, the Chairman of the Board of SWARA, Mrs. Valerie Allen Rollins, Director of Health, Dr. Ramu Tar, who else we have here from Southwest? The Chief Operating Officer, Mr. Allen. Anybody else? Dr. Robin Sinanan. I think we have the GM of Nursing. So we have a full team who can answer your technical questions. So, Happy New Year to Trinidad and Tobago. Happy New Year to members of the media. It's my absolute pleasure to be here this morning. As I normally do, this is my 6th year visiting San Fernando Hospital to ringing the new year by welcoming the New Year's babies. So, because of the COVID restrictions, we can't take the full media report into the wards as we normally do. I made a tour. I was here on Wednesday. I'm here again this morning. So, let's go over the news. Who is the first baby born for the new year? And you will get a list, so you don't have to write it down. We provide this. Or did I say you have the list? Yeah. So, first baby born at 12:06 a.m. at the San Fernando General Hospital was a baby boy born to Asha Dookie. We don't have the waiters yet. The second baby born for the new year, also at San Fernando General Hospital, was born at 1:45 a.m. a baby girl born to Kerlese Farraday. And coming in third place, again at San Fernando General Hospital, at 2:49 a.m., a baby boy born to Jacinta Williams. So San Fernando got 1, 2, 3. Well done. There were several other babies at Mount Hope. They did not win. At 3:08 a.m., baby girl to Aliyah Burke. 3:39 a.m., a baby girl to Shakira Jerry. And 4:52 a.m., a baby girl to Naomi Sedeno. So that is Mount Hope. San Grande Hospital, they came in last. 9:08 a.m. this morning, which was just 2 hours ago. A baby girl to Chanel Mahavir. And Port of Spain, 3:26 a.m., baby girl to Delia Wallace. Another baby girl at 4:16 a.m. to Celine Yearwood. And at 5:38 a.m., another baby girl to Shannon Bihari Holder. You will be getting still photographs from SWARA, correct? So we had the still photographs taken this morning of Asha Dookie, who gave birth to her little baby boy at 12:06 a.m. So those are the New Year's births for 2021. What a year 2020 has been and where we are going with 2021. With these new births, with these new bundles of joy, I think 2021 will be a better year than 2020. I guarantee you that. And why do I say that? 2020, as we know, the global pandemic of COVID-19 visited the world. It seems to be, well, not a 100-year cycle, but the last time we had to deal with something like this was in 1918 with the so-called Spanish flu, where it is estimated that over 50 million people around the world died in that global pandemic. One of the lessons that we learned from the 1918 pandemic was that when people relaxed after the first wave in 1917, 1918, the second wave, after people started to rejoice, the second wave was actually more deadly than the first wave. What is the lesson we have to learn for 2021? For 2021 to be the better year than we think and possibly know it is going to be, the population still has to continue with the simple public health measures. There is no silver bullet as yet, even though vaccines are on the horizon. We have to continue with the hand washing, the social distancing, the sanitizing, the not going to work if you are ill. And hence is the reason we couldn't take you into the wards this morning. We in health must not break our own protocols by endangering the lives of our mothers who have just given birth and the young babies whose immune systems are not fully developed. So, with that being said, I know you are going to have a lot of questions this morning about vaccines and what we hope for 2021. So let me just give you an overview of how 2021 can be a better year for Trinidad and Tobago than 2020. Trinidad and Tobago has done remarkably well with its COVID response. I can say without fear or favor that Trinidad and Tobago is probably one of the best places in the world to be right now if you are scared of COVID-19. Our case numbers are low. The 7-day rolling average is in the high teens to early 20s and has been like that for now about 2 to 3 months. Our case fatality ratio, which is a measure of how a country's death rate or death toll compares with other countries, was like this. The case fatality ratio is the number of persons who have died divided by the number of positive tests, individual positive tests you have in a country. That's how we calculate your case fatality ratio. The global average of case fatality ratio is in the region of 3%. Trinidad and Tobago's case fatality ratio is 1.77. So we are significantly lower than the global average. The country with the worst case fatality ratio, I wouldn't call the country, I have always resisted painting countries in a bad light, is actually 29%. That's the worst country. We are 1.77, but the global average is around 3. So by any objective measure, Trinidad and Tobago has done remarkably well. And for that, we need to congratulate not only healthcare workers, and we must congratulate them, but all the countries that have done well. And what are some of the countries that have done well? New Zealand, Vietnam, Trinidad and Tobago. Those countries did well because they had highest level political involvement and political leadership. In Trinidad and Tobago, you had that with the Honorable Prime Minister, Dr. Keith Rowley, leading the charge, believing in the science, listening to the scientists. And our chief scientist in this case was Dr. Rosha Parasram, who is now the individual of the year. And I think we could give him a round of applause. Dr. Parasram was the Chief Scientific Officer for Trinidad and Tobago, in whom the Prime Minister had total confidence, which made my job as Minister of Health so easy in leading the health response. What was the health response based on? In understanding past pandemics, which we learned from, especially the 1918 Spanish flu, the 2009 H1N1 crisis, which visited Trinidad and Tobago in 2009. People like Dr. Rambutan would have been around. You might have been a nurse then, Valerie? Yeah. You were at head office. Robin, you would have been around in 2009. Dr. Jagasa? Yeah? So, if we never learned from the Spanish flu, the 2009 H1N1 pandemic, and then learned lessons coming out of Africa and how they dealt with Ebola, we would have been doomed to repeat the mistakes of the past. At the Ministry of Health, we took a decision in early January. If we are going to manage this virus successfully, it could not be managed in our traditional hospitals. The last place you want an infectious disease to be managed is in a hospital, where you have other patients. That will become a super spreader event. So we set up to create a parallel healthcare system. And that parallel healthcare system has performed magnificently. Right now, in countries which have much more resources, much more advanced, much more money, if an individual, a non-COVID individual, wants an ICU space, they cannot get one. That doesn't happen in Trinidad and Tobago and has gone unnoticed. In those same countries, if a woman has to give birth, like they have given birth here, they cannot get a hospital bed in a maternity wing, in a maternity hospital, because all those beds have been converted to COVID beds. In those countries, someone who needs cardiac intervention cannot be treated because they relied on their traditional healthcare system to treat COVID. And that is the beauty of what we did. And the healthcare workers, again, performed magnificently. That is one of the reasons why Trinidad and Tobago is one of the best places in the world to be right now for COVID-19. This parallel healthcare system. We were able to shunt COVID suspect and people with COVID into 4 facilities: Cora, Arima, Hoover, and Augustus Long, leaving the traditional healthcare system to do what it does best. And the 2 systems wouldn't mix. So that is what we did. The results have spoken for themselves. But now, as we look forward to 2021, the new arrow in our quiver, the new tool that we have to look forward to, is the vaccine. The vaccine for this part of the world, we hope, and we are told by PAHO WHO, should be available to us by March of 2021. Trinidad and Tobago is pursuing the procurement of vaccines via 2 mechanisms. Mechanism 1, which I think you are all familiar with, is the COVAX facility. The COVAX facility is a joint facility between WHO, CEPI, and I forgot the third one. In that facility, we are a member. We have been preparing to be a member of that since July 2020. You have to sign various documents. You have to agree to certain things. So since July 2020, we have been preparing to be a part of COVAX to receive vaccines. Out of COVAX, we started individual bilateral talks with with about 2 vaccine manufacturers, 1 AstraZeneca, 2 Pfizer. We started with informal talks as early as September, and those talks graduated to more formal discussions by around November, December. We are also in bilateral talks with Sinopharm or Sinopharm out of China. And Sinopharm and China, they have 3 vaccine candidates that are part of COVAX. So, just to go back, Trinidad and Tobago is pursuing the procurement of vaccines via 2 mechanisms. 1, COVAX, and 2, out of COVAX. We are pursuing talks with Pfizer, AstraZeneca, and the government of the People's Republic of China. So far, WHO has approved the Pfizer vaccine, I believe, and recently the AstraZeneca vaccine. The Sinopharm vaccine is still in phase 3 clinical trials. Hasn't been approved as yet. When Pfizer announced that they were ready to start vaccinating folks, I think all the world and Trinidad and Tobago wanted to know if and when we will get Pfizer vaccines. At that time, Pfizer did not have WHO approval. What they had was emergency use approval. What is emergency use approval? It is a slightly lower regulatory bar or hurdle to cross. Because countries that have uncontrolled community spread, if you have a vaccine that seems to be working, you can start to use those vaccines because the benefits far outweigh the risks. Okay? So at that time, Pfizer did not have full regulatory approval. Trinidad and Tobago will receive, hopefully, its vaccines in March. People are asking, well, why don't we get it now? And I have been consistently saying, sometimes it is good for a country to be an innovator and to be first in line. But sometimes also it is good for a country to be second, third, or fourth in line. By March, the world community, which is currently vaccinating people by the hundreds of thousands, it means we will have a lot more what is called endpoint data. We will have a lot more safety data. We will have a lot more efficacy data. We will have a lot more data on the use of vaccines in what we call special populations or complex populations. For instance, the question is, can the vaccines now, as we are talking about births, be given to pregnant women? The answer right now is no. Because there is no evidence now to support the safety of administering the vaccines to pregnant women. But by March, the data will start to come out. Right now, the Pfizer vaccine is not approved for children under the age of 18, I believe. But by March, you will start to get that data. So the point I am making, our numbers are so low now, so low, as opposed to the United States and other countries, which have the vaccines for emergency use authorization because of their case numbers. Let us use this period between January, February, and March to look at more data. What we call, everybody knows about phase 1, 2, and 3 in developing a vaccine, because that has been the talk. There's something called now phase 4, post-market surveillance. What phase 4 post-market surveillance is? After a vaccine receives regulatory approval at the end of phase 3, surveillance and data collection on a new drug or a new vaccine does not stop at the end of phase 3. There's something called now phase 4, post-market surveillance, where you get data in real time, in big populations, you get more safety data, as opposed to phase 3, where you are limited to data on 30, 40, 50, 60,000 people. Now you will have data on millions of people. So you get more safety data. So as the Pfizer vaccine, as the AstraZeneca vaccine is approved after phase 3 trials, they will now go into what is called phase 4 post-market surveillance. And out of that, by March, we will have so much more safety data to make the decision of which vaccine is most appropriate for our populations. Is it safe to use in pregnant people? Right now it is not, because we don't have the data. Can it be used in children under 18? Right now we don't have the data. Can it be used in people with severe allergies? Right now the answer seems to be no. So let us use this period to collect as much endpoint data as we can, so that by March we can introduce a vaccine which is safe, which is effective, and which the population can trust. Because trust is going to be important as we roll out the vaccination plan. So ladies and gentlemen, that is a brief recap of where we have come from, a brief recap of where we are, and a brief recap of where we are going with our vaccination program by March 2021. In closing, before we take your questions, we must remind the population that the public health measures have to continue. The wearing of masks is now required by law, and wearing them properly over your nose and mouth, not here, not there. So, you don't want it hanging down like that. You see people walking around with the mask like that, right? You see people wearing the mask like this. Your neck doesn't breathe. You see people wearing the mask all out. Please wear the mask like this. Cover your nose, cover your mouth. Don't have it hanging from one end. Don't wear it below your chin. So ladies and gentlemen, before I close, I just want to thank everyone who has been part of this COVID experience. The population has responded magnificently by and large. The media, you all have been very, very good in getting the messages out and in reporting on the issues. And I want to thank you most sincerely. I want to thank healthcare workers again and again and again. So with those few words, I think I can come to an end now and we can take your questions. If you have no questions, that is fine. I can go home for New Year's lunch. So who's going to be first? I see TV6 is priming up. Go ahead.
How concerned is the ministry about the new strain of COVID-19?
Yeah. Okay. So the new strain, which is coming out of England. Okay, so let's go back. Viruses mutate. That's what they do. I think the lay population was caught by surprise because the layman is learning more and more about viruses. So let's put it in context. Every year, you have to get a flu shot, correct? The flu shot that worked last year is not going to work this year. Why? Because the H1N1 virus mutates. It changes every year. So when you hear about the COVID-19 virus mutating, that is no surprise or no shock to anybody, any scientist, any nurse, any doctor. That's what viruses do. To answer your question directly now, To prevent that new strain from getting a very strong foothold in any country or in Trinidad and Tobago, we never open the borders completely. The borders are closed. Could you imagine if you had jumbo jets with 300 people, 400 people landing in this country every day in Trinidad and Tobago bringing tourists? What would have been our position? So the government's position on closed borders is what has saved this country from having mass importation of that COVID-19 variant from England. There's also a variant from South Africa we are looking at, but it is a good thing that our borders are closed. So we are not, any scientist or any person in health will tell you we are not surprised that the COVID-19 virus has, as a matter of fact, it has mutated several times. That's what viruses do to protect themselves from being exterminated. It's their part of their survival mechanism. Okay? Any other questions? No? Okay. Yes?
I know you had urged persons to forego New Year's celebrations and stuff. Have you had any reports of COVID parties or anything?
Yes. As I said, you are never going to get 100% compliance of any population. Any population. The vast majority of citizens of Trinidad and Tobago have been good. But it's that minority I have been appealing to not to have All Year's Night parties. How successful those appeals have been will show up in the numbers starting from around the 10th of January. That's when we will start to see the uptick in numbers as to how we behaved 2 and 3 weeks prior. So how we behaved in the week before Christmas, that will start to show up by around the 7th of December. How we behaved Christmas Day will start to show up by around the 13th, 14th of January. How we behaved last night will start to show up between the 15th to the 21st of January. So from tonight, the CMO and myself are going to have some sleepless nights again as the figures start to come in. Dr. Hines will be tracking it to see what these figures mean, what the figures are telling us. So that's where we are. We can only know how we behave when we get the figures in 2 to 3 weeks. Okay? Any other questions? If not, I want to wish each and every one of you and your families a very happy New Year, a safe New Year, and once again, thank you, ladies and gentlemen of the media, for the excellent work you have done in carrying and covering our part of the global COVID pandemic. Thank you very much.
Happy New Year and have a great day.